The question I modified a bit. It is actually
Yes.
hormonal and metabolic response.
Metabolic response.
It's
Yes, sir.
always combined with both.
Yes, sir.
So I have informed that also. Hope Shivashankari is ready to answer the modified question also.
Yes, sir.
Right. Go ahead.
My topic for today is hormonal and metabolic response to trauma. Traumatic injury is one of the many stimuli that trigger a set of metabolic changes, which is known as stress response. Stress response is the body's damage control system, which is intended to maintain homeostasis and to provide substrate for the repair of the injury. It involves a set of hormonal and inflammatory signals that produces a hypermetabolic state. The hyperglycemia and mobilization of the additional energy substrate from the muscles and fat stores that occur in order to fuel for the body functions. The stress response has two controls arms, which is neuroendocrine arm and the inflammatory arm. The neuroendocrine arm consists of the neural part and the endocrine part. The neural part involves the brain, spinal cord, and the afferent neurons, whereas the endocrine part involves the hypothalamus, pituitary, and the adrenal gland. The corticotrophin releasing factor is released from the hypothalamus in response to trauma, which increases the ACTH release from the anterior pituitary, which in turn acts on the adrenals to increase the secretion of the cortisol. The activation of the sympathetic nervous system causes the release of adrenaline, which also stimulate the release of the glucagon. The counter-regulatory hormones like glucagon, glucocorticoids, and catecholamines have a major role in the metabolic response to the injury. Then growth hormone and ADH. These are secreted by the pituitary, which the ADH causes salt and water retention, and the mobilization of the energy substrate is done by the growth hormone. The rise in growth hormone is proportional to the severity of the tissue injury, and the metabolic effects occur via the insulin-like growth factor 1, which promotes protein synthesis and inhibits the inhibition of protein breakdown and promotes the lipolysis. The growth hormone also stimulates glycogenolysis by the liver, and the anti-insulin effect also limits the glucose uptake and utilization in the tissues. Then inflammatory arm. It is mediated by the cytokines, which are chemical messengers released by the cells which are produced in the first 24 hours. The major cytokines produced in the inflammatory response are interleukin 1, TNF alpha, interleukin 6, and interleukin 8. These acts directly on the hypothalamus, which cause hyperpyrexia. Then the acts directly on the skeletal muscle to induce proteolysis and play a complex role in the development of peripheral insulin resistance. The inflammatory arm, which is controlled by the cytokines, is triggered by the immunological response, which promote hemostasis, wound healing, and control of infections. Acute phase proteins are produced in the liver, which are inflammatory mediators, and antiproteinases and free radical scavengers involved in the tissue repair and augment, otherwise modify the immune response. In a whole, the stress response triggering factor acts on the hypothalamus, which it triggers a release of corticotrophin releasing factor, which acts on anterior pituitary, which releases ACTH. This ACTH acts on the adrenal cortex, releasing cortisol. This cortisol promotes gluconeogenesis and promotes glycogenolysis. Whereas the triggering factor acts on the brain, which causes sympathetic activation, which acts on adrenal medulla, releasing adrenaline, and peripheral it releases non-adrenaline. These catecholamines causes vasoconstriction, tachycardia, and in the peripheral tissues they promote muscle lysis and promotes muscle catabolism. In liver, in pancreas, the sympathetic activation can cause glucagon act on the pancreatic islets of Langerhans alpha cells, which increases glucagon. This promotes gluconeogenesis and promotes glycogenolysis. In liver, it promotes gluconeogenesis and promotes glycolysis. Then, in a summary, hormones whose levels are increased include ACTH, cortisol, growth hormone, insulin-like growth factor 1, ADH, and glucagon. The hormones which are reduced include insulin. The phases, then metabolic response. Metabolic response has two phases, which is ebb phase and a flow phase. The ebb phase lasts for 24 to 48 hours, whereas the flow phase lasts for days to weeks. The ebb phase may be attenuated by proper resuscitation, but not completely abolished. The F phase is characterized by hypovolemia, decreased basal metabolic rate, reduced cardiac output, and hypothermia and lactic acidosis. The predominant hormones regulating the F phase includes catecholamines, cortisol, aldosterone, following the activation of the renin-angiotensin aldosterone system. The main physiological role of the F phase is to control both circulating volume and the energy stores for the recovery and the repair. The flow phase. The following the resuscitation, the phase evolves into a hypermetabolic flow phase, which corresponds to systemic inflammatory response syndrome. This phase involves the mobilization of the body energy stores for the recovery and repair, and the subsequent replacement of the lost or damaged tissues. It is characterized by tissue edema, which is due to vasodilation and increased capillary leakage, increased basal metabolic rates due to hypermetabolism of this phase, and increased cardiac output, raised body temperature, increased oxygen consumption, and increased gluconeogenesis and leukocytosis. The flow phase can be subdivided into catabolic phase and anabolic phase. Initial catabolic phase lasts for 3 to 10 days, whereas the anabolic phase lasts for weeks. During the catabolic phase, there is increased production of the counter-regulatory hormones and inflammatory cytokines, which results in significant fat and protein mobilization, leading to the weight loss. The increased production of insulin at this time is associated with a significant insulin resistance. Thus, the injured patient, trauma patients exhibit poor glycemic control. Then the catabolic elements of the flow phase. During the response to injury, not all the tissues are catabolic. The body prioritizes itself from the peripheral tissues, where it catabolizes the substrates and move to the major organs like liver and immune system for wound healing. Then flow phase, the changes that occurs are hypermetabolism, with the energy expenditure occurs about 15 to 25% above the normal healthy resting values. The alterations in the skeletal muscle and the protein metabolism during catabolic state of stress response, the muscle wasting occurs as a result of an increase in muscle protein degradation, coupled with decrease in muscle protein synthesis. The major site of protein loss is peripheral skeletal muscle. The patients with the skeletal muscle wasting will experience asthenia, which is weakness, and increased fatigability, decreased functional ability, decreased quality of life, and increased risk of mobility and morbidity and mortality. Insulin resistance. Following trauma, the postoperative hyperglycemia develops due to increased glucose production combined with decreased glucose uptake in the peripheral tissues. The factors that compound response to the injury include volume loss, which is due to continuing hemorrhage, hypothermia, tissue edema, starvation, systemic inflammatory response syndrome, and immobility. That's all, sir.
Okay.
Thank you, sir.
We have covered all the points, but there are a lot of repetition. So we can cut down all those repetitions to make it more concise. And so I hope all of you have heard or read about this particular topic. It is very important because the stress response to trauma, the trauma can be accidents or even your surgery is a trauma. But what is the difference between an accident causing trauma and a surgical trauma? This is a common question the examiners may ask you in Viva. See, in surgery also, you are cutting the patient, you are putting a retractor, especially if you are going to do a major abdominal surgery. You are going to make a large incision, you are going to cut the abdomen muscles, stretch the muscles, then handle all the bowel and pull them out and then put them back. So that is also a sort of stress. But what is the difference between an accidental trauma and this surgical trauma?
The accidental trauma, there is bleeding and sir.
Pardon?
In trauma, there is bleeding and hypovolemic shock the patient will present, sir.
Okay. Supposing major vascular surgery, have you not seen a bleeding and hypotension happening? Or when you do a Whipple surgery or a liver transplant surgery, are you not seeing a lot of bleeding and hypovolemia happening.
Surgical trauma is an anticipated and planned one, whereas
Fantastic. That is, it's a controlled environment. Surgical trauma is a controlled environment. We have everything. We know that we are going to cause such problem, isn't it? When you plan a major surgery for a patient, you want to block the sensation of pain. You want to block the sensation of hypovolemia. You know how much blood loss is going to happen. You are ready with blood or fluids, and you always monitor the patient and try to keep the milli-interior within normal limits. Whereas in an accidental trauma, nothing is in your control. You don't know how many major injuries a patient is going to happen if there is a road traffic accident. Okay, he may have multiple bone fractures. He may have a lot of soft tissue injuries. Okay, so there the hypovolemia or the pain or the shock that happens, it all depends on the volume amount of trauma that happens, which is not under our control. Okay? And the stress is caused in both the conditions. The same responses only have to act to restore the normal milieu. The response of the body to any stress, whether it is a controlled environment or a accidental environment, the body wants to protect the person or the person who is suffering the stress. And that comes in the form of hormonal response first, which is of course stimulated by the neural system. As you rightly said, it is a neural stimulation which is going to be reflected on the three important endocrine glands, the pituitary, the adrenal, and the pancreas. These are the three important endocrine glands which are going to be activated because you want the cortisol to be released, you want the catecholamines to be released, and you want the insulin and other glucose to be released for energy utilization. Okay? And once the stimulation has occurred, then based on that stimulation only all the metabolic responses happen. And that metabolic response has been described by Kurt Patterson in 1932 into these three phases: ebb phase, flow phase, and the recovery phase. Okay? Some people say there are only two phases, but it is a prolongation of the second flow phase into recovery phase is also included as the third phase. Okay? So the ebb phase is nothing but an acute stress where injury has happened and patient is trying to first survive. So at that time, our efforts to bring back the patient to normalcy is very, very important. If anybody is not able to get a proper treatment at the ebb phase level, at the first 24 hours level, whether it may be burns, whether it may be major trauma or major surgery, in any of these situations, within the first 24 hours, if we don't take care of all the changes that are taking place, those patients only go into irreversible state of shock. They are not able to come out of that. And once they go into the irreversible state of shock, all the organs start failing one by one. And that is called multi-organ dysfunction syndrome, MODS. And to assess that only, we have a quick scoring system like the SOFA score and other things, which we try to see whether they are being normally brought back to functional level. Okay, so this is how the whole time answer has to be prepared, and try to avoid the repetition. The first description you had to say again and again about glycogenolysis, gluconeogenesis, 2-3 times it was being repeated. That is not necessary. And the easy flow diagrams are the drawings which can incorporate all the three, that is the neural element, the hormonal element, and metabolic element. There are a lot of pictures available which I will show you. If you remember that, it is easy to write your verbal description or the description in sentences by after drawing this one diagram. You can simply write the explanation on the side and finish off that answer. Okay, I will just share my screen.